Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent will knock out first the highlights. As new reports estimate up to 1 million vaccines expired in Nigeria last month. Delta State government says it has not yet received the Johnson & Johnson vaccine. And Pfizer-BioNTech says 3 shots of its vaccine neutralized the Omicron variant of COVID-19 in laboratory tests. Thank you for joining us. Nigeria has recorded over 100 new COVID-19 infections across 7 states of the Federation and the FCT. According to the Nigeria Center for Disease Control (NCDC), a total of over 207,000 people have now been treated and discharged. It also added that Delta and Enugu states reported a backlog of cases for December 6, 2021. Here's more on the latest figures on the COVID-19 update.
107 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT, indicating a drop from the figures reported earlier. The FCT logged the highest infections with 38 cases, followed by Oyo with 21, Rivers had 17, while Edo registered 13 cases. Other states include Delta with 7 cases. 4 cases were logged in Enugu and Zamfara, while Plateau registered 3 cases. The new tally has increased the total confirmed cases in Nigeria to 214,896. The report also includes a backlog of cases reported from Delta and Enugu and 0 cases from Kano, Ogun, Ondo, Osun, and Sokoto states. 17 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,495. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll to 2,980. Currently, there are over 4,000 active cases in Nigeria, while over 3.6 million samples have been tested so far. More than 7.2 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.8 million persons have been fully vaccinated. The total global confirmed cases have surpassed 267 million, while deaths are beyond 5.2 million.
In the meantime, the Federal Ministry of Health has been explaining the reasons why over 1 million doses of COVID-19 vaccines expired. A statement signed by the Minister of Health, Dr. Osage Hanire, notes that some of the vaccines donated to Nigeria through the COVAX facility have 3 months shelf life, and the country could not reject them since they were free. The statement also notes that Nigeria has utilized most of the over 10 million short shelf life doses of COVID-19 vaccines it received and has withdrawn all expired vaccines from the shelf. And over to Delta State, where the government says it is still expecting to receive the Johnson & Johnson vaccines. According to the government, the AstraZeneca and Moderna vaccines are available at the various accredited vaccination centers across the state, advising residents to access vaccination centers for their jabs, especially with the new threat occasioned by the Omicron variant. The state government also says it is intensifying its sensitization and awareness campaigns to help reduce the panic caused by the new variant, urging residents to continue to keep safe with these safety measures as advised by health authorities.
I can confirm authoritatively that, yes, when we began the COVID-19 vaccination program, that was in the early parts of the year, we did receive the Oxford AstraZeneca vaccines, and then during the second phase of the vaccination program, we did receive more Oxford AstraZeneca vaccine and, of course, the Moderna vaccine. But at this time, the states have not taken delivery of the Johnson & Johnson vaccine. But there are hopes that in no time, the states will receive some doses of the Johnson & Johnson vaccine. This is to be able to add up to the pool of the vaccine that is required to be able to get more people to be vaccinated. we in Delta State were not resting our hands as far as COVID-19 is concerned. You remember, during the first wave of COVID-19, when we had our lockdown measures, first instance, and of course subsequently, even at the point where we succeeded in flattening the curve of COVID-19 in the state, we didn't rest in our hands. We were working tirelessly.
And back to our top story, where, according to the Federal Ministry of Health, Nigeria, as of late, enjoy the generosity of several mainly European countries who have offered the country doses of COVID-19 vaccines out of their stockpiles free of charge. While the ministry says that the donations are always acknowledged and thankfully received, some of them had residual shelf lives of only a few months, leaving the country a very short time, and some just weeks to use them. Well, joining us to talk more about this is Dr. Yohe Akase, infectious diseases expert. He joins us virtually. Thank you for joining us on the program.
It's a pleasure to be here. Thank you.
Thank you. What's your take on the news of the up to 1 million expired vaccines in Nigeria?
That's very unfortunate, to be honest. But it's something, I think, two things I want to say about this is I appreciate the honesty of the government to have come up and said that we do have expired doses, probably because of the close monitoring. But it's something that close observers have known for a while this was going to happen. We don't know how much of a problem the issue of acceptability of vaccines has been, in the country. So it's something that we knew was going to happen, at the point in time. Unfortunately, I would think that the government was, for a number of reasons, we didn't want to come up and say this. Probably maybe when it was a month to these vaccines expiring, they should have come out and say, you know what, we have vaccines expiring in a month's time. So everybody knows, because at the moment, to be honest, we are all Nigerians. The issue of acceptability and hesitancy about vaccinations, especially to COVID, is a big, big problem. And on one hand, we don't have enough vaccines for the population. On the other hand, we're struggling to vaccinate people with the few doses we have. And it's really, really, a big problem, going forward. Not only in terms of covering, the country and the population as a whole, but in terms of those, currently we're reliant on donor vaccines. So it's going to be a hard sell telling people, give us more vaccines when they know that you're having difficulty finishing the ones that are, completing or vaccinating people, the ones that, seemingly is not enough for your population. But then again, you are unable to meet up with quota. 3 months is short, but it's not that short for, for something that is not enough. We all
All right, Dr. Akase, just to ask, and this is because the Federal Ministry of Health said that short shelf life appeared to be the problem. But one is also asking, on the other hand, in terms of, is it in good faith to send vaccines that are about to expire?
Well, ideally, proper stockkeeping, requires that feedback should exist, where you're also where you're getting vaccines from. You let them know that, okay, we have vaccines that are supposed to expire, in so amount of time. So much so that one would expect that, 1 million doses it is something that, I'm sure there are other countries elsewhere that can, benefit from these vaccines, where the trajectory of vaccination is not keeping up, with what you have. So by the time you have 6 weeks you have been given vaccines for 3 months expiry, 6 weeks to the time of, expiry, somebody is made aware that, at the rate which you are going, we may not, and these vaccines may expire. The expiry of those vaccines it's not something that caught, everybody unaware. The trajectory of vaccination should have alerted, the storekeepers or the people, monitoring those vaccines that, it's possible we're going to have expiry. And so it's only right that if you are close to that, we're talking about equitable distribution of vaccines from the rich to the poor. And here we are, having, 1 million doses of vaccines expired. So, even within the states in the country, there was a situation where, some states had more vaccines than others, because their vaccination rates were less. some of those vaccines were mobilized from those states to other states that, were having greater demand, and those vaccines were used up. So really, at this stage, when we are talking about, vaccine injustice, and vaccine inequality, about the rich people hoarding, the rich countries hoarding vaccines, and we, on the other hand, receiving donated vaccines, and then, that being, expiring on a shelf, it's not good.
Seem to be having an audio challenge, but then it really appears that looking at the process of vaccines and distribution, the country has to look inward to ensure that it goes as smooth as possible and this doesn't occur again. But in terms of the shelf life for the COVID-19 vaccine, what is it?
Yes, so generally vaccines, depending on the type, of course, have very short half-life. So most of them, you're talking about 3 months to 9 months, 3 months to 6 months on average. So these are not obviously this is not something you're going to keep, for a long period of time. At most, a matter of months. Of course, the issue of the manner of storage also matters. So, for example, you have vaccines that if you store them at lower temperatures, they will last for a longer period of time. The fact that AstraZeneca can be stored at room temperature for up to 3 to 6 months is it's an advantage in itself. However, this is what everybody knows, that vaccines, being proteins, do have very short half-life. Most of them do not go beyond 9 months, being kept in very, very stringent storage requirements. So the short half-life of vaccines is not news. I mean, it's something that we've known.
And I was going to say, Dr. Akase, the fact that this is the AstraZeneca vaccine set to have expired is also quite interesting, seeing as it is a vaccine that is easily manageable. Do you in any way see vaccine hesitancy as a big challenge in all of this?
Yes, vaccine hesitancy is a big problem. And we'll talk about this in the context of acceptability. At the moment, we have those who have outrightly rejected vaccines. Then we have those who are hesitant about taking these vaccines. Those who are hesitant are probably are still sitting on the fence, waiting for the right kind of information to convince them to go get a vaccine. Probably someone has told them something that, has made them scared about it. But definitely as a country, then, there are those who sort of distrust anything that comes from government. So these are all various factors, and the people, the community of those who are not taking vaccines, even though they're diverse group, some who are up, reject vaccines, some who are hesitant, and some who don't distrust anything that comes, from government, and then of course by extension, the other global, donors, as a whole, it is something, but it is a big problem in the country. I mean, we're a country of almost 200 million, where we cannot finish 10 million doses. It tells you all you need to know about how much hesitancy, there is. Of course, now the government is putting up, modalities of having to put what's called a vaccine mandate, where, public servants are forced. I mean, of recent, I was privy, to certain discussions among, certain public servants who had to resume back to work. And personally, someone has approached me and asked me if I'm able to facilitate him getting a vaccination card without getting vaccinated. So it is a real problem. And unfortunately, this happens even among healthcare workers, the hesitancy part. So I'm aware of healthcare workers who have not been vaccinated, for whatever reason, there is. So to be honest, the issue of hesitancy is not just among the uneducated or the ignorant people. We're seeing this among, well-educated people. It's not, of course, not just an Nigerian problem, global, but more so, the country when we're talking about our health indices, the benefits of vaccination being the only way out, of this repeated cycles, of that. So it is a big task the government has and all the regulatory agencies to try and, and overcome this problem of vaccine hesitancy. And until we do that, it's going to be a big problem on our hands. Yeah.
Indeed. We would like to appreciate your time. Thank you so much, Dr. Yohan Akase, infectious diseases expert. Thank you for joining us on the program.
It's a pleasure. Thank you.
Still to come on the program, it's a tough life in Italy on the measures in place against COVID-19. Join us again for more. Welcome back. And outside Nigeria, Finland's Prime Minister Sanna Marin has apologized for going clubbing after coming into close contact with a COVID-19 case. Sanna Marin went on a night out in Helsinki on Saturday, hours after her foreign minister had tested positive. She was initially told she did not need to isolate because she had been fully vaccinated, but later missed a text that advised her to do so. The Social Democrat Prime Minister said the text message that advised her to avoid social contact was sent to her work phone, which she had left at home. And more than 11,000 candles, one for each Swiss victim of the coronavirus pandemic, lit up the December darkness. This is outside the Swiss Parliament in Bern on Tuesday night. Around 40 volunteers helped light the candles arranged on the square that is Switzerland's political center. The group organized a similar event last year. Organizers say that the vigil was also an appeal to the government to take firmer action to contain soaring infections.
So this is the Corona Candlelight Vigil, and we are commemorating the 11,288 people who have died of COVID-19 in Switzerland. And this is both a vigil where we mourn for the dead, but it is also a silent protest. We're protesting the government's policy that have led to so many deaths in Switzerland. And we were asking that the government change its strategy now, immediately, and go towards a strategy of low case numbers and not filling the hospitals anymore.
May their souls rest peacefully. Meanwhile, Italy is making life more uncomfortable for unvaccinated people this holiday season, excluding them from indoor restaurants, theatres, museums, starting to reduce the spread of coronavirus and encourage vaccine skeptics to get their shot. Italian police have been empowered to check whether diners or bars have a super green health pass, certifying that they are either vaccinated or have recently recovered from the virus. Smartphone applications that verify people's health pass status have been updated as well to prevent entry to concerts, movies, or performances to those who have merely tested negative in recent days. The measures run through January 15. Now, Dr. Oladipupo Oluwafemi is a general practitioner in Pavia, Italy, and he joins us now. Thanks for joining us on the program.
Hello, thanks for having me.
All right, we're hearing since October, the COVID green passes have been required to access workplaces, train stations, and what have you. We understand that there's also the COVID super green pass. Now, explain to us, is there a difference between the two? Help us understand it.
Oh, well, basically, the difference between the super green pass and the green pass isn't so much, but then when you are vaccinated, when you've gotten the two first doses, you get the green pass. Now, the super green pass would have to do with being vaccinated and also testing negative for COVID-19 and also recovering. Now, how do you spot the difference between the green pass and the super green pass? Now, to get the super green pass, you have to have been vaccinated in the first place, okay? And for the green pass, you have to be vaccinated and recovered from COVID-19 and also tested negative. So if you are not vaccinated at all, you cannot get the super green pass. So I think that's the difference between both terminologies used.
So essentially, with all of the measures so far, especially for the unvaccinated, how is the normal for them?
Well, again.
In terms of, how Italy has introduced the tougher restrictions for the unvaccinated and with many public activities off limits. So how have this really affected the normal?
Oh, well, inhabitants of Italy are quite cooperative, in the sense that even before the new decree of having a green pass to access any closed door or any huge public gathering, if you must get into an enclosure, let's say a bus or a train station or a train, you need to have your mask on. Okay, and that is still ongoing. That hasn't changed. However, from the 6th of December, of course, the Italian uh, government put up a new rule such that if you must get on a bus or in a restaurant or any closed gathering or even outside where you have to shop in a public space with huge number of people, you might be checked for COVID-19 using the green pass. Even if you have a test result showing a negative COVID test, you might get into trouble. And also in Italy, you are not really uh, uh, forced to get vaccinated. However, you and I know to get so many things done, you will need to be vaccinated at some point in time. Now, taking it to the workspace, to keep your work life going, you need to be vaccinated. Else, you won't be allowed into the working premises. Now, there's an exception to that. The few set of people that are actually forced to get vaccines in Italy are the police, the military, and the teachers. Okay, but for individuals, it's not really compulsory.
So if we look at the weeks ahead, I mean, the number of new infections in Italy has been on a gradual rise for the past 6 weeks, which might be a worrying trend. And also many look forward to the holidays to spend time with family and friends. And this is after what we know happened last year, the stringent measures. Do you think that Christmas is still looking as merry with the restrictions so far in place?
Well, of course, it might not look as merry as we should have it, but then if people can just abide by the rules stated by the government, I think they can have a sizable Christmas. Um, because safety first before sorry.
We'd like to appreciate your time. Always a pleasure. Thank you so much. Dr. Oladipupo Oluwafemi is a general practitioner who's joined us from Italy. Thanks for joining us.
Thanks for having me.
Pfizer and BioNTech say a booster jab of their coronavirus vaccine promises to be an effective defense against the new Omicron variant. Plus, Germany recorded its highest number of daily deaths from COVID-19 since February. Here's more on the global COVID-19 update.
BioNTech and Pfizer say a 3-shot course of their COVID-19 vaccine was able to neutralize the new Omicron variant and say they could deliver an upgraded vaccine in March 2022 if needed. The German and US companies say 2 doses of their vaccine resulted in significantly lower neutralizing antibodies, but a 3rd dose boosted those antibodies by a factor of 25. They're the first manufacturers of a COVID-19 vaccine to issue an official update on the efficacy of their shot against Omicron. The World Health Organization earlier said vaccines should still work against severe Omicron cases. In other developments, Germany has recorded its highest number of daily deaths from COVID-19 since February, as it struggles to bring a fourth wave of the pandemic under control. A total of 69,601 new infections were reported, and an additional 527 people died in the past 24 hours. Germany last week announced a nationwide lockdown for the unvaccinated, barring them from accessing all but the most essential businesses. The ban doesn't apply to those who have recently recovered from COVID-19. South Korea's new daily COVID-19 cases has risen above 7,000 for the first time, putting hospital capacity under strain as deaths and severe cases rise. The Prime Minister says the government will mobilize additional personnel to oversee coronavirus patients treating themselves at home and improve the emergency transfer system to hospitals for those who develop severe symptoms under the at-home treatment. And the United Kingdom is marking a year since a Briton became the world's first person to receive the Pfizer-BioNTech COVID-19 vaccine outside of clinical trials, with authorities urging people to get booster shots as soon as they become eligible.
The patients that we were getting in my COVID wards are mainly the ones that are really, really poorly, with no medical histories, are young and fit and unvaccinated. And we've also had a lot of pregnant women that's come into my wards that's come really poorly because they are also unvaccinated. And that is something that I would like to push forward to tell people that if you're unvaccinated, there is still a chance. It's not too late.
Britain has now given nearly 120 million doses of COVID-19 vaccine, either as first doses, second doses, or boosters.
For a better understanding of the pandemic, visit our website. It's channelstv.com. It has more updates as well as other stories. Thank you for watching the program this evening. I'm Millicent Walker. Stay healthy.